Okay, good.
Good morning, everybody. Thank you for being here. I'm Nathan Murphy. I'm the State Director for Environment Michigan. We're a statewide, nonpartisan environmental organization that advocates for the places we love and the environmental values that we share. We're here today to call on Ford Motor Company to stop undermining the clean car standards that are successfully working to protect the health of our families and save consumers money at the pump. I'm a Michigan guy. I grew up in Michigan, in mid-Michigan. My first car was a Ford Tempo, and I learned to drive on my dad's Ford Ranger. I learned to drive a stick shift on my dad's Ford Ranger. I'd love nothing more than to be up here talking about the leadership that Ford Motor Company is showing in making a cleaner fleet of cars and protecting our climate. Unfortunately, recently Ford has worked aggressively with the current administration to undermine the achievable clean car standards that are working right now to reduce air pollution in our communities. Air pollution that harms our most vulnerable family members, including children, seniors, and people struggling with breathing issues like asthma. 2 days after the election of President Trump, Ford signed a letter asking the federal government to revisit those standards. 2 days. Standards they agreed to a handful of years ago. In the months since signing that letter, Ford continued to work on rolling back those standards that the Environmental Protection Agency reports is achievable, is working as predicted, and is coming in for less than half the cost as originally predicted. These standards reduce the air pollution that hurt people in the Metro Detroit area and other urban centers. They also save consumers millions at the pump as newer cars use less fuel to go further. Last year, the Union of Concerned Scientists determined these standards are already saving consumers nearly $40 million each day in fuel. That's about $44 billion saved as of 2016. The average household has pocketed about $250 in those savings, thanks to those rules. And while consumer savings are important, they're only a small part of the picture. We're here today to talk about the health impacts and the health benefits that we get from those clean car standards that Ford's opposing. Keeping these standards means healthier kids, fewer asthma attacks, fewer missed work days, and a number of other positive health effects. It's hard to put a price on our community health and the children in them and breathing easier. To talk more about the harm of air pollution and the costs of rolling back these standards, I want to introduce Dr. Amy Shultz. Dr. Shultz is a professor at the University of Michigan School of Public Health and received her PhD in sociology and her MPH in health behavior and health education from the University of Michigan. Her research focuses on social factors that contribute to health, with a particular focus on social and physical environmental factors and their effects on health, health equity, and urban health. Dr. Shultz.
Thank you, Nathan. Delighted to be here today. Detroit and surrounding areas, such as Dearborn, have historically experienced challenges with air quality. Each year in the Detroit metro area alone, air pollutants account for 690 deaths to area residents, 1,800 hospitalizations and emergency room visits, and 63,000 lost work days, and with 780,000 minor restricted activity days. They also account for about 570,000 days of school absences related to asthma exacerbations and other health effects. The grand total of that for the Detroit metro area alone is that air pollution accounts for about $6.9 billion in monetized impacts. The impacts of poor air quality disproportionately fall in poor and minority populations and communities. The transportation sector accounts for the largest share of many pollutants in urban areas. In the Detroit area, that accounts for about 30% of all greenhouse gas emissions. We know that the roughly 24 million people nationally who live within 100 meters of heavily trafficked roadways are exposed to high levels of pollutants from the transportation sector, and they experience increased risk of asthma, but also cardiovascular mortality and poor birth outcomes associated with those exposures. In the Detroit metro area alone, the transportation sector accounts for 4,000 days of respiratory symptoms for children with asthma and about 8,000 days of restricted activity or lost work days. Reducing transportation-related emissions has immediate benefits. Studies have shown that reductions in hospitalizations, adverse birth outcomes, and asthma exacerbations occur within a period as short as a week of reductions in air pollutants. Clean car standards have the potential to reduce air pollution. We have the technology to meet those standards, and we should not be rolling back safeguards that protect the thousands of children and vulnerable adults who are adversely affected by emissions from cars and trucks. Thank you.
Thank you, Doctor. Next, I'd like to introduce Dr. Toby Crow-Lewis. He's a medical doctor and an MPH, Associate Professor of Pediatric Pulmonary Medicine at the University of Michigan, and working with C.S. Mott Children's Hospital.
Thank you, Nathan. It's also my pleasure to be here today. I wanted to start with a question. How many of you have ever experienced an asthma attack or watched someone that you care about struggle to breathe? If you have, you know exactly how precious the ability to breathe comfortably is. And even if you've never had that experience personally, I think you can appreciate how scary it is when you can't catch your breath. And it also helps you appreciate how lucky we are when we can take a full breath of clean air. As Nathan mentioned, I'm a pediatric pulmonologist, which is a lung doctor for children. I spend my professional life taking care of kids with breathing problems, helping them to breathe more easily. But wouldn't it be better if we could prevent the breathing problems in the first place? Part of my work is to conduct research to learn how air quality impacts children with asthma and to learn what we can do to make it better. For almost 20 years, I've worked as a member of Community Action Against Asthma, which is a partnership of Detroit and Dearborn-based community organizations and researchers at the University of Michigan. Together, we've conducted several research studies and projects to understand the role of air quality on the health of children with asthma, to figure out who's most at risk, and to develop interventions to improve health. So with that background in mind, I'd like to take a few minutes to just summarize a few key points about air quality here in Detroit. So first of all, air pollution is a long-standing concern for Detroit residents and continues to be identified as one of the top public health priorities by Detroiters. And it's not just Detroiters. I think we all want to breathe clean air. While there have been very impressive improvements in air quality, the American Lung Association reports that 125 million Americans, or nearly 40% of the population, still live in counties with unhealthy levels of either ozone or particulate air pollution. People in certain communities, such as Detroit, are exposed to higher levels of ambient air pollutions relative to other communities. And this has a measurable impact on people's health. Residents of Detroit disproportionately experience high rates of environmentally related diseases, including asthma. So 15.5% of adults and 13.3% of children in Detroit have asthma. And for adults, that's about 29% higher than the rest of Michigan as a whole. There are well-established health effects associated with air pollutant exposure, including asthma exacerbations, which is what I'm most familiar with. But it also includes lost work and school days, deaths due to cardiovascular and respiratory disease, and adverse birth outcomes. It's important to know that vehicle emissions are a major source of air pollution, and over the last few decades, the total number of vehicle miles traveled has increased steadily. According to the EPA, transportation produces more than 1/4 of greenhouse gases that worsen climate change. And climate change indirectly affects the triggers that trigger asthma attacks. The clean car emission standards are important because they provide actionable targets reducing emissions from cars and trucks, which can have considerable impact improving air quality and health, which is particularly relevant here in Detroit. As someone who cares deeply about helping children breathe, I'm a strong supporter of clean car standards, as they offer a clear path forward to enable us to breathe cleaner air. It's logical that we continue to support these standards, and it's really unconscionable in my mind that we would consider stepping back from them. Thank you very much.
Thank you. Next, I'd like to introduce Kathleen Sloniger. She's a registered nurse and the executive director of the Michigan chapter of the Asthma and Allergy Foundation of America. This is a nonprofit charity dedicated to education and training of all those affected by asthma and allergies, as well as the professionals that take care of them.
Thank you, Nathan. I'm really honored to be here today and among such elite clinicians. I really appreciate your input. And I want to just reiterate that we know the research is showing that air pollution worsens asthma symptoms, plain and simple. People with asthma are at a greater risk for breathing in the small particles found in air pollution, causing their asthma to be worse. Both long-term and short-term exposure can cause health problems such as reduced lung function and more asthma attacks. People with asthma are more likely to visit the emergency room on those days where their air quality is poor and pollution is high. And I've seen this play out during home visits that we've made in the past, where we wonder where the children are and the parents say, oh, they had to go to the emergency department. Asthma is the most common chronic condition among children, and it's the leading cause of pediatric hospitalization as well as emergency department visits. And in Michigan, that includes about 225,000 children. When I'm talking with families about proper asthma management and control, they really grasp the concepts of controlling their triggers, taking the right medicine the right way at the right time, fairly easy once the information is presented. But the troubling thing that we've noticed is that for the families that live near highways, bridges, and tunnels, there are more incidences of asthma, and these folks are showing more severe symptoms of their asthma that are very difficult to control, even with the right medicine the right way. This is supported by growing evidence that shows higher rates of asthma and more frequent hospitalizations that with decreased lung function and lower school attendance when they live near these sources of air pollution. As we know, the transportation sector is now the country's largest source of carbon pollution that causes climate change. Cars and SUVs and pickup trucks are the largest source of this pollution. The automakers helped write these standards, and they have the technology to continue meeting these standards. But now they're trying to roll this back and back out of their commitment that they had made to make the cleaner air, more efficient vehicles that really drivers want. There was a poll done, and more than 7 out of 10 Michiganders support the current clean car standards. And a majority of those were actually Republicans. We know that schools in Detroit, when they're near highways, actually also have higher missed school days. We know that in Detroit, pediatric asthma claims among the low-income Medicaid patients increase when they're near these roads and tunnels. I want to say that for the sake of each of us, for the sake of our children, we must not roll back these standards. We actually need to strengthen these policies. We have a real opportunity here to pave the way for a cleaner energy future that reduces pollution and gives us cleaner and healthier air. So by transitioning to clean, renewable energy, and reducing energy waste. And we have an opportunity to reduce the dangerous pollution that is linked to heart and lung disease, among other chronic conditions. And even more importantly, we have a duty to change policies that remove the systemic barriers that cause minority communities and economically disadvantaged groups that suffer the brunt of these unjust policies. Let's move forward. Thank you.
Thank you, Kathleen. Next, I'd like to introduce Kendra Wide. She's a registered nurse with a master's in public health. She's been a critical care registered nurse for over 18 years and a public health advocate since 2011. She's the coalition coordinator with Michigan Air, Michigan Health, and works to educate policy and decision makers on the health impacts of their decisions on air quality. She also educates and trains healthcare professionals to be advocates, both in and out of hospital settings.
Good morning. Thank you, Nathan. As Nathan described, I am a registered nurse. I'm also a public health advocate, and I am the coalition coordinator for My Health. And My Health is a nonprofit coalition of health professionals that believes that every community in Michigan should have clean air to breathe. That's why I'm here today. I'm here to make it very clear to the auto industry leaders that they should be supporting the clean car standards, which help to reduce tailpipe emissions and protect the health of Michigan communities. Transportation emissions are the largest source of greenhouse gas pollution and other toxic pollutants in the United States. Michigan ranks as one of the worst states in the nation in terms of diseases linked to air pollution, such as heart disease, stroke, chronic respiratory conditions like asthma and COPD, and I see much of this in the patients that I take care of. We already know that it's a known carcinogen. Back in 2013, the World Health Organization declared particulate matter and air pollution as a whole as carcinogenic. And now there's even emerging research that's showing linking long-term exposure to air pollution to developmental and cognitive disorders as well, such as Alzheimer's disease and dementia. It's also very important to note that there are very few risk factors that contribute to such numerous negative health outcomes with such a sweeping and broad exposure, and air pollution is one of them. The best way to limit this exposure is through comprehensive legislation that takes these known health impacts into consideration. And since 2012, when these standards, these clean car standards were initially adopted with broad support from automakers, labor, and consumers, they have successfully increased fuel efficiency requirements for cars, trucks, and SUVs. These standards decrease oil consumption, cut greenhouse gas emissions, and put money back into the pockets of Michigan's residents. Fuel efficiency standards also lower greenhouse gas emissions, which helps to combat global warming. So knowing all of this, why does the current administration continue to try to push and roll back these safeguards? Let's be clear, tailpipe pollution is a well-documented cause of serious health problems, many of which Detroit residents suffer disproportionately. Rolling back or weakening the clean car standards will create more health problems in Michigan and even cost lives. We need to celebrate, support, and strengthen the clean car standards and not threaten them by weakening these safeguards. Our air quality and the health of Michigan's most vulnerable populations depends upon it. Thank you.
Thanks, Kendra. Last, I'd like to introduce Dr. Bruce Bakar. He's an OB/GYN physician who is also the public health representative for the City of San Diego's Climate Action Plan Implementation Working Group, a mentor for the Climate Reality Project, and currently serves on the board of the Climate Action Campaign. He's an author and frequent speaker on the health effects of climate change, and he's recently presented original research on the ongoing impacts on women's health at the American Public Health Association annual meeting in Atlanta.
Good morning. Thank you, Nathan, for that introduction. We're talking about Ford Motor Company and cars today, but of course I want to talk about human health. And in particular, the health of those that are most vulnerable. And we're talking about elderly and chronically ill, the poor, and women and children. These are the people most likely to suffer emotionally and financially, to get sick, to be hospitalized, and even to die prematurely from the effects of vehicle emissions. So what's the link between cars and human health? Well, first of all, the burning of fossil fuels, gasoline and diesel, immediately deteriorates air quality as it accelerates climate change. When you have climate change, you have warmer temperatures. This increases circulating levels of pollens and particulates and ozone, and all of these are very toxic to human beings. Climate change also radically changes fire behavior. In Southern California, we had data as of 2012 that showed a tripling of incidents of fires, burning 6 times more area. And when I was growing up in Los Angeles, the average large fire lasted 5 days. Now they last 3 weeks. This is a drastic change in a very short period of time. Fires release carbon monoxide, which is a poison, and also very toxic chemicals and particulates. And these emissions from fires travel hundreds or even thousands of miles beyond the fire, so they affect far more people than are immediately injured by the fire itself. This is not some kind of future threat. When we're talking about climate change and dangerous air pollution, we're talking about something that's affecting people right now in the U.S. We're also not talking about just the effects of extreme weather, things like fires and floods and massive storms. We're talking about heat, and in terms of heat waves and lack of nighttime cooling, and air pollution and infections. Things like West Nile virus, valley fever, GI illnesses after flooding. All these things are directly related to climate change. As an OBGYN, of course, I'm focused on the health of women and girls. And we're doing some research right now, and the data is particularly alarming. We're finding out, as has been mentioned today, that asthma in adolescent girls is far more prevalent than it is in boys. That when women reach midlife, they're more likely to suffer not only from asthma, but they're also at risk due to air pollution for lung cancer, the #1 cancer killer of women, and also heart disease, which is the #1 overall killer of women. Elderly women are more likely to have heart attacks and strokes due to air pollution, and they're also more likely to have early onset dementia. I think we could all agree, and we listen to the speakers here today and are reminded that women are way too important in society and in academia and in families to allow them to be cumulatively injured across their lifespan, as air pollution and climate change continue to do. The impacts on pregnancy, though, are even more alarming, and we're now seeing data that shows that heat and air pollution are very well correlated with premature birth and low birth weight. And even in those babies that survive those insults, they often have lifelong behavioral and physical consequences. And neonatal death and stillbirth are also related to heat and air pollution. If we don't bring climate change and dangerous air pollution under control, our current evidence suggests that we're risking not only the well-being of vulnerable groups, but literally an entire generation of U.S. children from birth onward. You have to stop and think about that. That's an amazingly broad and dangerous impact to allow. Ford has a choice. They can return to their past and to put profits ahead of people and progress, or they can become major players in building a healthier future. And they're talking that way. There was just a week ago an announcement that Ford plans to hybridize and bring out electrified versions of their big trucks and SUVs, and even the iconic Ford Mustang, which was my first car. This is a really positive change, but it's not going to happen for 3 or 4 years in best case. And I don't know about you, but I can't wait 3 or 4 years to take my next breath. Beating climate change is going to take some time, but cleaning up automobiles can have an immediate benefit. The health professionals that are signing this letter, and there are hundreds of us, are asking that Ford publicly defend the clean car standard and not stay on the sidelines. These are being threatened in Washington, D.C. It's time to defend them. They should also improve the efficiency and lower the emissions of their current models. They have lots of engineers. This is a company with global reach. They have plenty of people working for them. They could be doing better with the cars they have right now. And Ford already makes fuel-efficient vehicles, hybrids and EVs, but they don't sell very many of them. It's time to build a lot more of them, put them at the front of showrooms, and actually train your sales staff that this is a priority. Maybe set some sales quotas that they can hit. It's about time to lead instead of just hoping that people will do the right thing. The good news is that the health effects that we're talking about, the suffering, the hospitalizations, the premature deaths, and even the impacts on children are largely preventable if action is taken now. Ford can take bold steps right now, today, that will have immediate benefit for people's lives, and it's time for them to do that. We in the health professional community are going to be watching what they do. Thank you.
Thank you, Doctor, and thanks to all of our speakers. It's pretty clear from the numbers and facts that people have presented, we know the health effects of air pollution, not just at a local scale, not just at a regional scale, but at a global scale. The air pollution, the tailpipe pollution affects people. It hurts people. It hurts communities and families. It hurts children, women, seniors. And, you know, other facts are clear too. We have these clean car standards in place. They're working, car companies are meeting them, and they're meeting them at less cost than they forecast. These are achievable, workable goals that make real differences for the families in our community. They reduce asthma rates, they reduce missed work days, missed days from school, missed hospital visits. All this has a positive impact on the people that we love and on the economic well-being of our communities. It's time for Ford to stop working to pull back those standards. It's time for them to be a good corporate citizen and show leadership and actively support these standards that protect our families, not just in Southeast Michigan, but around America. And not just America, but around the country. So I thank you for your time and attention, and thanks again to our fabulous speakers. And thanks for being with us today.
All right.
Quick
Yeah, we can talk. Edit it out.